Dr. Piasecki here, coming from ProCare Chiropractic Center, and today I want to talk about a herniated disc. Now, a disc is a specialized cartilage between the bones of your spinal column. It attaches to the vertebrae above and below it. This creates a separation between the vertebrae that gives a cushioning, and it also creates a space where the nerves can come out of each side of your spine. Now, each spinal disc consists of two regions: a jelly-like region in the center or the core of it, and a hard fibrous outer region around the outside. Now, healthy discs will give you normal flexibility so that you can bend and move and turn. Now, when you have an unhealthy disc, it can be one of several things. It could be a bulging disc, a protruding disc, or a herniated disc. Now, a bulging disc, any of these bulging, protruding, or herniation can be caused by repetitive improper lifting, slips, falls, car accidents, any number of mechanical injuries. Now, a bulge is when this jelly-like substance in the middle gets pushed over to one side. It can get pushed over enough where it may, cause you some pain and maybe even some pressure on the nerve. Now, if these discs are in your lower back, you might get this pain that's going down your leg, because that's where the nerves in the lower back go. If this disc we're talking about is in your neck, you may get those symptoms that are going into your arm. But a bulge, think of a balloon, so a water balloon, and you push it, you tilt the spine like it's in between the water balloon from one side to the other, it's going to bulge out, to that side. Now, the next thing I want to talk about is a protrusion. Now, a protrusion is when this has been bulging for a period of time, and this outer fibrous layer starts to break away, and so the jelly-like substance starts to migrate into the fibrous tissue. This also can cause you quite a bit of pain, restricted motion. It could even put some pressure on the nerves. Again, if it's in your neck, or it could go into your arm. If it's in your lower back, it can be going into your leg. When it's in the leg, a lot of times you might have heard the common term called sciatica. Now, the last is a complete herniation, or what they call a prolapse. This is where the hard, fibrous tissue completely tears away, and the inner substance comes all the way out of that disc itself. And when that happens, it typically is going to wrap around the nerve that comes out of the spine. Now, when you get this wrapping around the nerve, you're definitely going to have pain that goes into your leg, and probably some pretty severe pain in your back. Now, chiropractic care has always been a natural approach to dealing with disc problems. At ProCare Chiropractic Center, we typically we see disc problems on a daily basis. We have even had patients who were told that they needed surgery, and once they went through a course of treatment, we were able to save them from having to have the surgery and get them back to moving and living the way they want to. So, if you have a disc problem, you really should give our office a call, 412-854-6900, or visit our website, www.procare-chiro.com.